Hello, I'm Dr. Bruce Eimer. I'm a licensed psychologist here in South Florida. I'm a board-certified hypnotherapist, and I'm also a board-certified diplomate of the American Board of Professional Psychology. I was the director for 7 years of pain psychology at a very busy inner-city-based hospital pain clinic. I've authored a number of books, textbooks and self-help books on hypnosis, hypnotherapy, and brief psychotherapy to help people with chronic pain, anxiety, and depression. And I'm here today to talk to you about an upcoming webinar that I'll be giving under the auspices of the International Medical and Dental Hypnotherapy Association this month. Registration for this 2-day online webinar can be gone to at their website, which is www.imdha.com. More information about this webinar and about my work can also be obtained on my website, which is www.bruceimer.com. That's BRUCEEIMER.com. I'd like to ask you a couple questions at the outset of this brief presentation. This presentation is actually geared towards practicing hypnotherapists and other therapists who want to learn how to use the tool of clinical hypnosis more effectively to help people who are depressed, who come to them for help to feel happier, more functional, and also to get help for a variety of the other types of issues that people go to hypnotherapists to get help with, such as changing habits, stopping smoking, losing weight, having motivation, and so forth. None of these things can be accomplished if somebody is depressed. So, my first question to you is, would you like to feel confident that you can reverse a depressed client's negative thinking in your first session? My second question is, would you like to learn how to use hypnosis to change your client's negative self-talk? My third question is, would you like to know how to choose the best induction and the best treatment strategy for a depressed client? And question number 4 is, how would you like to use hypnosis to be able to energize depressed clients? Well, if you answered yes to any of these 4 questions, you're definitely in the right place, so listen carefully to what I have to say. Today I'm going to share with you 3 things. Firstly, I'm going to tell you my story briefly. Secondly, I'm going to dispel some common myths that have basically discouraged hypnotherapists from using hypnosis to treat depressed clients. And then the third thing that I'm going to do is I'm going to share with you 3 easy things that you can do to begin to help more people in your practice. Okay, let me just simply tell you a little bit about myself. I've been a licensed psychologist since 1986. Over the years, I've had my struggles with anxiety and depression. I also have chronic pain. I learned early on, years ago, that self-hypnosis was a very valuable, effective tool for me to help me manage my pain and my moods, and to help me keep anxiety under control. Several years ago, I lost my wife, who died by suicide, which was very traumatic. And in the aftermath of that, I developed an autoimmune condition which causes widespread pain throughout my body. In addition, over the years, I've had to cope with spinal stenosis and what it does in terms of causing severe sciatica and physical pain. I have found that whenever my thinking gets negative, usually as a result of an accumulation of stressors that can be overwhelming, that I experience more pain and I experience more anxiety, and I begin to worry about getting discouraged and becoming depressed. I had a turning point in my life several years back when I met some very, very helpful people, both of whom are hypnotherapists, who helped me to begin to understand that I needed to work on myself regularly in order to nip problems in the bud before they got worse and became full-blown. That I also needed to forgive myself and others for past mistakes, that I needed to let go of old resentments, and that I needed to accept myself as a fallible human being, that I needed to take care of myself in the same way as I, for years, have helped my clients and patients to do for themselves. I've been a caregiver all my life. I get very preoccupied with being a caregiver, and sometimes I neglect myself. But when I have the feeling that I'm not doing well enough, I can become overly critical of myself, and over-criticism and anger turned inwards and lack of self-acceptance all can lead to depression. So I've studied with a number of very smart people, some psychologists, some hypnotherapists who taught me how to quiet, my little boy. That's my German Shepherd. He wants to play. I will take you for a nice walk and a nice ride later, okay? But first I have to finish my talk to these people. Anyway, these mentors of mine have taught me the value of hypnosis in treating depression and how to adapt hypnotic techniques and the whole model of using hypnosis as a tool, therapeutically that is, to help people to get undepressed. I'm going to be teaching a 2-day webinar on this in a couple of weeks, and we're going to cover everything in detail. But in the meantime, let me first share with you 3 myths that have actually prevented or discouraged people, that is therapists, from using hypnosis to treat depression. The first myth is that when someone's in hypnosis, that they are not able to critically evaluate what they're hearing, that they're just a passive receptacle. It's basically the old zombie myth that, you know, when a person's in hypnosis, they'll accept whatever is delivered to them in terms of suggestions. And that's completely untrue. When people are in hypnosis, they're not zombies. They're still actively processing information, albeit on a deeper level, as their conscious, critically evaluating mind is taking a rest, and the unconscious mind, the gateway to the unconscious mind, is open, so it's possible to provide them with information, if it's presented in a language they can understand, that their subconscious mind can accept. People, when they're hypnotized, won't accept suggestions and start doing things that goes against their values. What you give in terms of suggestions has to be relevant. I wrote an article about inadvertent negative consequences in the use of hypnosis that discusses all of the factors that need to be taken into account to reduce the risk of causing harm using hypnosis. That article was published in 2012 in the American Journal of Clinical Hypnosis as part of a special issue that I actually guest edited. And I will make that article available for free to those of you who are watching this presentation. Second myth that has discouraged hypnotherapists and therapists who use hypnosis from using hypnosis to treat depressed clients is this whole idea that when people are depressed, they're slow, they're fatigued, they don't have much in the way of motivation, they are, basically unable to get going. Often you see people who are depressed, very depressed, as my late wife was in the years preceding her taking her own life, where it seems when you look at the person, the pilot light behind their eyes is completely gone. They just move very slow, if at all. And sometimes, in severe cases, they can seem catatonic. So the idea that hypnosis would put somebody into a super deep, relaxed state where they couldn't move obviously mitigates against using hypnosis with people that are in that kind of negative trance state anyway. But there's been a lot of research that has proven that there are many different ways to use the tool of hypnosis and therapeutic trance states. There's such a thing as alert hypnosis, which has been written about by many respected psychologists who use hypnosis in doing therapy, that hypnosis could just as conveniently be used to create a more energized and alert state as it can be used to create a relaxed state when that's clinically indicated. In addition, as I mentioned earlier, the idea that hypnosis basically puts somebody into a state where they're a passive recipient of suggestions is completely untrue. The third myth that has discouraged therapists from using hypnosis with depressed clients has been the idea that people who are depressed are self-critical, and they tend to disavow anything positive. They tend to disqualify the positive from pretty much everything that they are involved in. And the idea here is that it wouldn't be possible to be able to reprogram that kind of negative mindset simply through using hypnosis. That it requires a much more prolonged course of therapy utilizing logical, rational types of approaches, as has been promoted and empirically validated by the cognitive therapies and rational emotive therapy and so forth. But what people don't recognize is that some very, very powerful practitioners of cognitive therapy, such as Albert Ellis, who's the father of, the late Albert Ellis, the father of rational emotive therapy, and Aaron Beck, who is the father of cognitive therapy, have used guided imagery and hypnosis as part of their systems of therapy for years, as long as the hypnotic techniques that they used were part of a treatment plan that was based on a valid conceptualization of the case, of the client. Okay. Now, what I'd like to do at this point, and there are other myths that we can talk about, that we will talk about in my webinar on using hypnosis to treat depression. A lot of work on the effectiveness of hypnosis in the treatment of depression has been done by a psychologist by the name of Dr. Michael Yapko, who has written a number of books on the topic, and his work has been very influential in helping me to develop my thinking and my techniques in the use of hypnosis to treat depression. Now, I would like to share with you several action items which you can put to use immediately in your practice. The first one is this idea that I have developed, which is that depression shouldn't be fought, that it needs to be tamed. That means it's important to learn how to for yourself if you get depressed, or for your clients who are depressed, to teach them to listen to their depression as a message that is trying to tell them something, to do something different, that they need to pay attention to and find out what their mind and their body is telling them with the depressive symptoms. I've developed a model called the AWARE model, or the AWARE hypnotherapy model, which we will go into in much more detail in my webinar. The AWARE model is based on the idea that one has to first accept reality, no matter how distasteful it is. Secondly, one has to make a commitment to doing the things that need to be done in order to change that reality. The W in AWARE stands for watch, which basically involves learning to observe, pay attention to, and watch one's own internal responses, one's outside behavior, and how people respond to one's behavior. The third letter in AWARE stands for adjust, A. And we teach clients, Leo, oh, you got your thing where you can't get it, his ball, I guess it is. It's behind the table. You could go get it. See, it's right in there. Come on, go get it. Right in here, yeah. There it is. Yeah. Oh, you want me to get it for you? Okay. Sometimes you just have to give in. Here, I'll put it over there for you. You could go get it, and then you'll bring it back to me. Thank you. Thank you. Okay. Now, sit. Sit, buddy. Good. Now, here's the thing. I'll give you the ball again, and now I'm going to continue with my talk. So, adjustment of what one's internal responses are based on what one observes, adjusting one's behavior, one's thinking, one's expectations, one's responses. And there's a lot about that I will be teaching in my webinar that is drawn from the cognitive behavioral literature and the hypnotherapy literature, utilizing direct suggestion in hypnosis, as well as the idea that we could do analytical hypnotherapy to find things out, which basically is the fourth letter in AWARE, which is the R, which stands for release, releasing unneeded, old, worn out emotional burdens, releasing resentments, and so forth. And then the fifth letter in the AWARE model stands for envision, which is envisioning a positive and viable future, which is something that people that are clinically depressed are unable to do while they are depressed. They don't see a future. Okay, now I'd like to give you the second action item, which I think you'll find helpful, and that is it's a brief experiential technique that I'd like to share with you that you can experience right now if you're in a safe place and not driving a car, and which I assume you're not because this is a video. And basically it's a mindfulness strategy that you can do very easily. You can practice it very easily, and all it involves is sitting down, situating yourself comfortably, remaining alert, closing your eyes, take a few slow deep breaths, breathing in slowly through your nose, filling your lungs completely with air, breathing in all the way, taking that deep breath and holding it at the very top of the breath, and then letting it go, releasing that breath and letting go of all the stress and tension all the way out. Taking another deep breath, filling your lungs completely to capacity, breathing in all the way, holding that breath for a moment, and then letting it out again all the way down as you blow out that stress and tension. That's right. And feel that release. Do that one more time. That's right. And now, just continue to pay attention to your breathing without trying to change your breathing. Notice how your breathing changes all by itself. Be curious about how your breathing changes. That's right. Allow whatever comes into your mind, whatever you hear, whatever you feel, to just be there without changing what you're paying attention to right now, without judging anything, refusing to let anything disturb you, allowing everything that you hear and see to just contribute to your experience of going into balance, taking a little bit of time to stay in a balanced state inside, be open to your experience, not judge, just simply watch and observe and accept. That's right. And then, when you're ready, just simply slowly open your eyes. You can count to yourself from 1 to 3 or 1 to 5 to sort of pace yourself. And then when you're ready to be fully awake and alert and feel more clear-minded and more calm, open your eyes and feel sound in mind and sound in body and in control, totally in control of your feelings and your thoughts. And this is an exercise that you can do on your own. It's an exercise that you can teach your clients. And it's one of many, many different experiential exercises that we will be going over, that you will be experiencing when you take my webinar, that I'll also give you easy instructions for applying as techniques in your work with clients, and also teaching you when to use them and when not to. Okay, now I promised 3 easy things that you can do to help you to be more effective with your clients and also begin to take better care of yourself as a hypnotherapist or as a therapist right away. And so the third action item is that I'd like to encourage you to go to the website of the International Medical and Dental Hypnotherapy Association, imdha.com, and register for my workshop, the webinar that is, and simply think about the benefits that will come to you as a hypnotherapist when you become confident in your ability to use hypnosis to treat depressed clients and begin to have success in helping clients who are depressed begin to feel more in charge of their moods and more in charge of their lives as they become less and less depressed and more self-confident. Think about how your reputation will improve, how your ability to help more and more clients will grow, and how you can begin to reflexively apply these kinds of techniques that you will learn in my webinar and begin to practice in helping yourself to live a more balanced life and to listen to your unconscious more clearly rather than trying to ignore or fight the kinds of emotional symptoms that we all at different times in life experience as part of the stress of living. When you take my workshop, or my webinar that is, you'll also get access to some materials that you will be provided with at no additional charge, such as several books that I have written about using hypnotic techniques to cope with anxiety and pain, and a workbook that is currently in progress on hypnosis for treating depression. Okay, well, I do appreciate your listening, and I hope to see you at the webinar. Again, my website is www.bruceimer.com. That's BRUCEEIMER.com. You can also go to www.hypnosisce.com for several continuing education programs, video training programs on hypnosis for treating anxiety and chronic pain. That's www.hypnosisce.com. And go to the website of the International Medical and Dental Hypnotherapy Association, which is www.imdha.com, so that you can find out more information about the virtual conference that will be happening in less than 2 weeks from now, and about the 2-day webinar that I'll be running that you can participate in the quiet and safety of your home while you learn how to use hypnosis to treat depression. Thank you for listening. Stay safe, stay well, and until next time.